Hi, my name is Elijah Hanif. It's July 10th, 2025, and today I'll be presenting my endocrine system video assignment. The condition that I chose to present this week is Addison's disease. This is also known as primary adrenal insufficiency. This condition is when the adrenal glands make too little of cortisone and too little of aldosterone. There are multiple symptoms for this disease. To get started, there's tiredness or fatigue, dizziness or fainting due to postural hypotension, which is a type of low blood pressure due to low blood glucose or hypoglycemia. There can also be sweating, abdominal pain, nausea, vomiting, diarrhea, muscle weakness, and also joint pain. Some visible symptoms are loss of body hair. There's also darkened spots on the skin and weight loss. It also affects the mental health of those affected. Depression, lower sex drive, and salt cravings as well, mood changes. So how would this be diagnosed if you're feeling these symptoms? One could be a blood test. So talking with your healthcare provider, we would take a blood test to measure the levels of sodium, cortisol, and ACTH, or adrenocorticotropic hormone, the levels of those in the blood. It can measure the antibodies in Addison's disease. Another would be an ACTH test. This would measure the levels of ACTH in the blood. So essentially what ACTH is that it tells the adrenal glands to make cortisol, and in this test specifically, ACTH would be injected into the blood, and then the levels of cortisol would be tested. Additionally, there are imaging diagnoses such as a CT scan of the stomach area to check for the adrenal gland size, see if there's any abnormalities. Additionally, an MRI of the pituitary gland can spot additional abnormalities or damage. So why does this happen? What are the causes? So damage to the adrenal glands is what can cause this. And the adrenal glands, it's made up of two layers. The inner layer is called the medulla, which makes hormones like adrenaline. The outer layer is what makes hormones like called corticosteroids, which is called the cortex. So some corticosteroids are called glucocorticoids, mineral corticoids, and androgens. These make aldosterone, cortisol, and sex hormones. Due to the body not making enough of these hormones because of the disease, some treatment includes taking medicine such as corticosteroid medicine to help replace these low levels. For example, hydrocortisone or prednisone those are some options to help replace the cortisol. Fludrocortisone helps replace the low aldosterone. Also, increased sodium incorporated into your diet is also part of the treatment plan. Possible complications can include, physical stress or illness. This can increase the toll it takes on your body.